In comparison to women, men are poor healthcare users and don't engage as well with the services on offer. This is something the GHA is trying to tackle, highlighting the importance of screening and regular checks. The campaign kicked off with an awareness stand in town and will feature a series of discussions at the King's Bastion cinemas.
It's across the board really that men are known for not accessing healthcare as well as their female counterparts. They're a bit more reluctant when they come and see their doctors. They perhaps just don't feel it's a men's thing to do. So their uptake is less. And often when they do come, they come with their partners perhaps because that's how they've been almost dragged in to see their doctors. So really what we're here to try and promote is that these services are available. We are offering them, it's just that we want people to access them. We want men specifically to access them.
I think people think men's health is just about men. Actually, men's health is about the community. The negative impact of poor health for men impacts on all of us, on women and on children. Because let's not forget that boys will eventually become men. So the message we want to get across and how we're trying to change attitudes is that men's health concerns all of us.
The focus is on changing attitudes, with different avenues being explored to raise awareness. Prevention is vital.
Screening is really, really important, and people, I think perhaps uptake on screening, particularly with men, is perhaps poor because they don't understand it, and they think that screening is going to be something very uncomfortable, very unpleasant, and so perhaps they just avoid it for that reason alone. So we really want people to come and see that it's not so bad. They want to come and take us up on the offer to just do some very simple tests, even if it's something as simple as a blood pressure.
Part of the campaign involves a series of discussions aimed at tackling the matter and raising awareness. So what's going to be focused on exactly?
This first event that we're holding on the 18th of May at the King's Bastion Cinema is going to be about screening, or about MOTing, if you like. Then we move on and we look at things like the second presentation will be on cancer in men. Then the third one will be on men and mental health. These are really important issues. And then the third one, we're going to look at lifestyles. And then the final one, which is going to be run in October, is about the heart and men, cardiac conditions in men. And the idea of these sessions are to ensure that men get the message. And so the way we present the message isn't about telling you what to do. It's about saying this is what you might want to do and giving you the information so you can deal with your health, yourself, with us helping you.
People's approach to healthcare may vary, but the men we spoke to in Main Street recognised the value of accessing services.
I didn't believe in checkups or doctors or things like that. I went once and I got very devastating news, so I would urge everyone to go and have a checkup from time to time.
Yes, I do my medical check on an annual basis. You get older, you need to. It's like servicing a vehicle, so we've got to look after ourselves.
With men, the question of prostate cancer and everything, just the thought of going in and having an examination is off-putting. And then we still have this machismo idea that, men are strong and nothing happens to you, men never cry. It's not true. We have the availability of screening. Just yesterday, I went for an endoscopy, just in case. It's unpleasant, but you should do it. It stands to reason.
The talks kick off next Thursday, featuring Professor Ian Banks, who's president of the European Men's Health Forum. The session starts at 7 p.m. and is open to all.